Okay, I think we are getting everybody let in. Hello, everybody. Uh, Welcome to this webinar. We are really excited to have you all here. We've got some great folks on, diving into both kind of Yale founder story, building for AI in this current day and age where the ground is rapidly shifting under us, and building in healthcare, which is a extremely kind of tough industry to get into in a very regulated space. So on today we have Natalia Khosla and Jonathan Goldberg and myself, Ellen Su-Marquez. Jonathan and I are both part of Accelerate Yale. Jonathan is also um, running Yale Angels as well, and so can talk a little bit more about that. Natalia is co-founder of SimbieAI, which we will be diving a little into her founding story. We are really excited to see you all here. Just a quick note, we will have some time for Q&A at the end. So as you're listening and getting ideas and inspiration, feel free to pop those into the Q&A section of the webinar, and we'll kind of review those. We'll leave some time at the end to dive into some of those questions. We may not get to all of them, but we do really appreciate everybody's engagement here. So really quick off the bat, we'll do a quick round of intros. So I'm Ellen Su-Marquez, board member of Accelerate Yale. I'm also a health tech founder and a product person. Currently the director of member experience at Health Map Solutions, which is a chronic kidney disease management company. Previously founded a startup, medical device startup, and got a lot of support through Yale for that. Managed through an acquisition. Really excited to be here. Jonathan, you want to give a quick intro to
Sure.
yourself?
Sure. Jonathan Goldberg, school management, MBA 2021. Recovering founder myself by day now with a company called Howard Hughes, a large diversified holding company, helping run up AI transformation and also volunteer my time with Accelerate Yale on the board with Ellen and a few others, and as a general partner for Yale Angels, which is a fund that's focused on investing in every Yale affiliated startup that meets our criteria, which is actually we're investors in SimbieAI. So really excited that Natalia's here and to talk about the success that she's had in building her business. And yeah, just good to be here.
Awesome. All right, Natalia, you want to kick us off with your intro?
Yeah, so good to be on here. Thank you both for organizing and really excited to be joined by the Yale community. So my name's Natalia. I am one of the two co-founders of SimbieAI. I'm the CEO and co-founder, and my co-founder Rachel, our president and COO. She is actually my roommate, suite mate since Yale days, undergrad 2014. We were in Saybrook. So Yale is absolutely inextricable from our story. It all started there for us. And yeah, really thrilled to be here to talk to you about the founding journey. Thank you so much to Yale Startup Index and Yale Angels. We're just really grateful to have Yale on board and with us from the journey from day one and through our Y Combinator days, which I'm happy to dive more into.
Awesome. Well, let's dive into that a little bit more. Tell us a little bit about your founding story. So, you guys didn't found the company straight out of Yale, but you did stay in touch. You guys have stayed friends. What inspired you guys to actually take a step forward to start a business together? Kind of what had you been doing since Yale, and then how did you guys end up deciding to actually take the leap into starting something together?
Yeah. So, like you said, our founder journeys were a bit different from especially a lot of the folks at that time that were in Y Combinator with us. We were in the Y Combinator summer 2023 batch. And so we were 2014 Yale. So yes, there's a big gap there. So for me, my journey was really to train as a physician. So I'm a physician by training. I trained over at the University of Chicago hospitals. I'm from Chicago, so I actually went back to like the community where I kind of grew up. And for me, the founding journey and deciding to build this together, Rachel and I were close, best friends since Yale. So like literally a day didn't go by throughout all my med school, all the days in the hospital that I didn't talk to her about what I was seeing, what I was experiencing. And similarly, she was actually spending that decade almost in early stage health tech. So, I'd say not 0 to 1, but -1 to 1. She's like an absolute strategy operations whiz. She was at companies like Carrot Fertility, Kayaba Care, Formation Bio, previously called Trial Spark, actually also founded by Yale, Ben Liu, who we know well. So for us, we knew we were going to do something, but for me in particular, I knew it was important to like become an expert in something. I definitely do feel that it was critical to become what I wanted to be in the world from like an area of expertise. I had wanted to be a physician from a young age. Both my parents are physicians in Chicago area. And it's the space that I knew I had unique insights to because I grew up watching my parents in this field that can be so amorphous and confusing to folks from the outside. So I was like, okay, I want to be a doctor, but and I can dive more into this, but it was really at Yale where I realized I can be something that's kind of a hybrid because I think that's the unique thing about Yaleys. They're always like a something plus, and like a slash slash. And those like hybrid identities, I think that Yale cultivates where it's like, hey, you can just be driven by a problem you want to solve or a curiosity that you have. It almost doesn't matter what career title you have, you can combine to become that, to solve that problem. That's what inspired me. And so Rachel and I put our heads together and we're like, okay, it's time to build now that I know medicine and she knows startups.
I was just raising my hand because I'm not sure how to do it on a small webinar panel like this, but I wanted to ask you, Natalia, I think it brings up a good point. I don't know much about health tech, healthcare. So do you think that your background, having grown up around it with, your parents being doctors, is that a barrier that someone can overcome if they didn't grow up in that environment to start a company in healthcare? I mean, or is it too daunting? How do you view that challenge?
Yeah, I would say certainly you don't need parents who are like in a field, right, to go into it. I would say though, and this kind of touches on this point of, at what point we decided to start a startup, having a unique edge or a unique insight, I think is critical to starting a startup and is critical to being successful. The good thing is everyone has one of those. Like everyone is born somewhere. Everyone knows something about where they were born, what they were born into. Everyone has an edge. And so I think the more important work is to understand what your edge is. What do you know about that someone doesn't else doesn't know? And then if you can hone on that, that is, I think, where one paradox of this psychologically is we all tend to take for granted what we know because in your own head it seems obvious. For me, growing up, I knew very well what doctors are pissed off about today. Like, I knew very well that they're angry that their reimbursement rates are being cut in settings of inflation. There seems to be no one in Congress who advocates for them. Their training doesn't not only does not teach self-preservation, it erodes it. And in the setting of the last 40 to 50 years, where hospitals have essentially gained all the power and insurance bulk buying negotiation power, they've consolidated and threatened SMB, like, private practices. So I knew those dynamics very well, but I think going into the world, I kind of thought, oh, but like kind of everyone knows that healthcare consolidation, but it's actually not the case. And I think everyone is surprised to learn that what they know is very much a unique insight. So that's what I would say people should dive into.
Mhm.
Yep. I'm going to jump in here because I actually came into healthcare from a non-healthcare background as well. I was, and you actually don't have to be a tech person either. So I was an art
Yeah.
major at Yale,
Cool.
and somehow ended up in medical devices and then healthcare. I think one of the biggest things that you have to realize, though, is that you have to listen. That's the first big thing. Like, healthcare is enormously complex. I do think there's a great quote out there where everybody is a patient, right? Healthcare is one of those fields where everybody, regardless of who you are, you will eventually become a customer of healthcare.
Mm.
And whether that's early, whether that's because a family member is dealing with health issues, whether that's you yourself kind of later in life, at some point everybody runs into it. One of the and you will see all the problems, right? You will run into how poorly run and managed and how many perverse incentives there are in healthcare, like full stop. But really taking the time to listen and understand where those problems are stemming from, it's not always the most obvious issue. It's not necessarily a technology issue. It's not because, you know, nobody has had a good idea to fix this problem or that nobody knows about this problem. It's really trying to understand the layers underneath that kind of resulted in this, which does make healthcare particularly complex because so many things are interwoven. But that's not to say that you can't do it. There are a lot of resources out there, and I would say nowadays there's so many doctors and just voices of people in healthcare speaking out, writing Substacks, posting social media kind of reels, and so there's never been a better time to kind of really learn from the source what those issues are.
Mm.
Absolutely. Absolutely. And to your point, like I think knowing the patient experience is a unique insight. Like knowing your experience as a user of healthcare is a very unique insight, that actually a lot of doctors don't have. I think that's where it comes down to actually like when I talk to people about starting startups, and I'm curious kind of both your perspectives on this as founders. Is, people will ask like, how do I come up with an idea or how do I get started? And I think the best ideas are not ideas, they are problems. Like if you spend like 90% of your time knowing a problem, and not just the problem, but who is the person with that problem, like attach yourself, I think, to a person. So in my case, it was always physicians. I was like, okay, I know docs, I know them well. Like, let me figure out what we can do to fix it for docs. But there's a lot of people in healthcare. There's payers, there's patients, there's all kinds of folks. So yeah, attaching yourself to a person with a clear problem, I think is the best way to start.
Yeah.
Yeah.
I do think that's another argument for, why it's also good to get industry experience
Yeah.
before starting a startup because you get kind of that level of access to like what are the problems and motivators for the people that might be, for example, on the other side of the negotiating table. If you're starting a startup to solve a problem for a person, if you
Yeah.
can understand what motivates that person, that goes a long way towards connecting with them and also figuring out like how do you build something that fits their need or that solves a problem for them.
Yeah, absolutely. And I think, this is something that we've seen and will continue to see evolve in startups and in venture. But I think something that's been a very clear trend and is going to accelerate even more now is so when we joined YC, I think the average age of folks in YC was like 21 or 22,
Oh
like
yeah,
very young. Yeah. And
it's like 23 now.
yeah, like we
Yeah.
were like, 30 in our 30s. And for us, really, the so there's a few things. Obviously, the advantages we experience that I think are very real is we kind of knew the industries we were from. We had networks built in them. We had been in them for 10 years. Like and so there's pros and cons to both sides, but I will say to this narrative that like you basically can only start a startup if you like drop out of college or like do it immediately out of college. I would say there's two different ways to build. And actually in today's day and age where engineering and technical resource is becoming more and more accessible to non-engineers. Just in the era of like sort of, not vibe coding, but just like, using LLMs to help code, then I think today more and more distribution has become the crux point. Like distribution is one of the hardest things in most industries, certainly in healthcare, go to market distribution. And so actually, if you're someone who comes from like an industry background or has spent time in a field, that leverage that you have of being able to hit the ground running, people, who to reach out to get your product out there. Some of the best products just sit, for a while because they're amazing and they've done so many innovations, but no one on the ground will have heard of it if they don't have a distribution network, which usually folks who've spent some time as professionals or in the industry will have stronger. So, anyways, I would say that both paths are realistic paths, but for us, yeah, we definitely felt like, oh, we're like the oldest people in YC. Like this is so interesting. But it really came to serve us well in an industry where, my customers are like older doctors and they like talk there's a certain lingo, there's a certain way of being. they're a little more formal. And so there were a lot of things that it was helpful to have insight into how that community sort of behaves too.
Yeah. Actually, I might use that as a segue. So I know you had talked about like being able to identify the problem. What problem did you identify with Simbi in particular? And how have you guys been kind of like building, rolling out? Like, how have you leveraged your networks and your experience as a physician to actually sell the product?
Yeah. So at SimbieAI, we build EHR integrated, AI agent systems that essentially complete all the work that happens between patient visits. So this is generally umbrella term is follow-up work. The critical point of follow-up is that, I like to describe it as there's four main things a doctor can do when you leave their office. They can refer you to another doctor. They can schedule you for another visit or a procedure. They can put in a test, like an imaging or lab blood work, or they can give you a medication. So that's kind of like four pathways. But all four of those pathways require a whole, like, gymnasium of tasks that need to happen, whether the patient needs to schedule their CT scan, go get their blood, their iron studies, then someone needs to review them. So that gets bottlenecked at the clinical piece. My experience in the hospital was that, we would have patients who we had just seen in clinic. We had given them an excellent plan. Like there was no lapse in diagnostics. I had a lady come, she's a 56-year-old woman coming in with shortness of breath, recent fatigue as of the last 3.5 months. She's never had a colonoscopy. Very concerning. She also had a history of fibroids. And so we put in a very clear plan. You need to call this person to get your, colonoscopy scheduled. Unfortunately, her insurance was not accepted at our hospital, so she could not follow with us. She had to go somewhere else to do this. But there were a set of steps, and she was supposed to follow back up in 3 months. Classic story. 5 months later, I was like, did she ever come back? Like, did anyone ever see her? And then she ended up in the emergency department with, a GI bleed that could have been completely avoided. But the problem when we talked to her was I didn't know who to call. I tried to schedule the CT. I called someone and left a voicemail. My kids are going to college. I was busy, a lot going on. So what we really do is automate that piece, handhold patients from one to the next using AI agents. And yeah, to your point, the core insight there for me was, okay, in the hospital, what is stopping patients from getting to their next visit? And what is costing the hospital money because they're not coming back? What's costing patients their lives because of logistics? Like that's a crazy reason. Logistics should not cost anyone's life.
Mhm. Well, and the logistics are particularly because other parts of the healthcare system are so opaque, right?
Absolutely.
Scheduling has so many barriers. You've got so much friction with getting tests done, with scheduling, with all that follow-up. And so, if someone has a lot on their plate, they run into that, and nobody's following up with them, then it's really easy for them to just give up.
Absolutely.
Yeah.
And I think, to this point, that the interesting part here, I've kind of spent so throughout the hospital and throughout healthcare, I think I'm sure you've seen too, like the number one chorus of doctors is we hate technology that people build for us. We hate it, we hate it, we hate it. That's like the thing that you bond and vent about at conferences, all of it. So, and why, like was my question too, right? But then honestly, when I entered the world of tech, definitely experienced some cultural, whiplash going from academic medicine to technology, very different worlds, different languages. I learned what it means to double click on something or to circle back. We don't use those terms in medicine. But went into it and I think I realized that the problem is there's very few folks that are going to be using the technology kind of like in the room where it happens, if you will. And so, so for us, the concept was, okay, what the gap is here is logistics, but there's also a clinical layer. Like one thing that happens in follow-up is it's not like you just go to the doctor, they do stuff, and then you just like go back. A lot of stuff happens in between that they never get paid for, and we don't realize that. Like doctors are not reimbursed, for example, today for they actually have to review every single blood work and imaging that you went and got, and it comes back to their inbox. They have to go through it, make a plan, reach back out to you, tell you what's next, and no one pays us for that. So I think that was one thing that I realized if we want to really solve the problem, it actually needs to be a clinically capable clinical decision-making tool as well. And that's really why that's where like our clear moat is like, logistics plus clinical decisions. So it doesn't get bottlenecked where the doc has to like review 80 messages in a day of results.
So it goes beyond just the kind of voice agent that's patient facing. There's a lot in that orchestration layer that is kind of working independently and working behind the scenes that's helping kind of smooth the path for the doctors. I'm curious, when you're working with the doctors, I know you had said like doctors hate technology.
Yeah.
One, is it easier to sell because you are a doctor? And then two, like what are the moments in like when you're giving a demo or when you're talking about your product, like what are the moments where they like really light up or where you can tell that they get it?
Yeah. So So definitely, I will say it's been helpful to be a physician because I think a lot of where we come to this from, and when I talk to our customers and to potential customers, we're basically like, look, we are you and we are angry on your behalf. And that is actually a lot of where this started for me was frustration. Like I saw my parents like who are, immigrants from India, for them becoming a physician in the US was basically one of the best tools for social mobility in this country. It played a really critical role. But I think unfortunately the training in medicine does also make folks very much ingrain this idea that like keep your head down, stay in your lane type of thing, and like never speak up for yourself. So I think unfortunately physicians become this relatively vulnerable entity in the healthcare system that can sort of just be used almost as like a plug and chug commodity today. And that's what you see in hospitals. Like doctors are literally like expected to see at this point a patient every like 10 to 11 minutes, which is absolutely insane and causes a large amount of like emotional drain. And so coming to the conversations when we start talking about that, right? Like our demos turn into like full on sessions about the future of healthcare, how, one of my life passions after, we get Simbi kind of really, really big level impactful is to revamp medical education altogether. Like I think medical education is where this all begins. And we talk to our docs in these demos about like, okay, like we know that your reimbursement rates have been cut in settings of inflation. They're like, you know that? Yeah, it's crazy. Like I know no one is sitting here sympathizing with doctors, but it's really hard to keep shop open. Like costs, everyone else's salaries have risen, including my staff, except for mine. Mine have fallen. And I think just knowing that and coming into that conversation, there is a level of trust that's built immediately where they're like, okay, honestly, we have been predated upon by tech companies for a long time now. Doctors
Mhm.
feel the overwhelming sentiment is like everyone seems to take a cut of this pie, except for the doctor and the patient. And those are the two entities that are in the precious um, experience that the whole system is built around, right? Is the doctor-patient visit, the medical appointment. That's the point of all of this. And somehow those two entities are the last one that anyone asks. And my hot take is patient satisfaction and physician burnout are two sides of the same coin. Usually, if you're doing something to hurt doctors, it is going to hurt your patients. Usually, if you're doing something to hurt patients, it's going to hurt their docs. So actually, if we focus on those two entities and not all the other kind of, I think, middlemen players we've seen take a big piece of the pie, you actually generate so much value. Um, so anyways, that's usually what we end up chatting about in our demos, and I think it really helps with that trust building and like we're not here to take from you. And actually, to that end, we have a number of physicians on our cap table who are investors. We heavily encourage physician investment in SimbieAI and like a lot space for that because again, we want to be a company that's like built not on the backs of physicians, but with them, and that they
Mhm.
also get to have a piece of the pie that we're building here at Simbie.
Nice. Quick question. Have you guys raised from Scrub Capital?
We have not.
Okay. I know someone there because they're basically a fund that's just all physicians investing.
Okay, yeah, I've heard of it. I was like, why does this sound so familiar? Yeah, we haven't raised from them, but I've heard of them.
Okay.
That would be great.
Yeah, let me put you in touch. The person who runs that is awesome. She's great.
Look at this. We got
Yeah.
Yale connective tissue happening in the middle of the
It's just
webinar.
organic connective
Yeah.
tissue.
I mean, I would love for you to revamp medical education as someone who is married to someone who just finished like MD, PhD in residency last year. I would love for that whole system to change.
I
It
could
is,
not. You've seen it live, and it's painful. It's
it is
crazy.
really
It's where you
painful.
realize things like this, right? And this kind of speaks in general to like innovation and entrepreneurship. I think so often we think like things are the way they are for like a reason, or like because
Mhm.
it's better, or like someone smarter than me, bit older than me, just learned, did a really good study and decided that way. Like that's so not the case for so many things. I think as you
Mhm.
grow up and go through the world, you realize like most stuff is just kind of like still there because it,
Yeah.
it just was there
Inertia.
before and it's
Yeah.
inertia. And, to change it takes like active effort. And so, anyways, I would say medical education squarely falls in that where residency, the concept of residency was literally made like 100 years ago and it has never been updated to kind of be relevant to modern day medicine. So,
I think this is a Yale connection because I think the guy who started the current system of residency was Cushing. Um,
yeah.
but also completely addicted to cocaine, and you can tell based on how
Yes,
residency is run.
100%.
Um, that's my fun fact about residency. And then the second fun fact, not fun fact, is that part of the issue of physician shortage is that there aren't enough doctors being trained, and you have all these people who want to be doctors that they're not getting matched in residency because
Yeah.
the number of spots for residency is set by Congress,
Yeah.
and only raises a set amount per year, and it doesn't keep pace with how the population has grown and does not match up with the demand of the number of people who want to become physicians.
Yeah, I think that's exactly true. And what I would add on to that is it's actually interesting because the committee that determines number of residency slots is also actually informed by committees of physicians and surgeons who have input here. Problematically, a lot the incentives and my kind of like mantra at the end of the day is like people respond to incentives. So like if
Mhm.
I really am not a believer in like some inherent greed of human nature. I actually don't think that's true. I think what's true is that people respond to their incentives. And today, the incentive is for physicians to want to narrow the funnel of people allowed to become physicians because that's the only lever they have access to pull to keep their salaries reasonable, honestly. And I
Mhm.
know that again, like physicians tend not to be a community that we see like a lot of advocacy for because they're doing well. But we have to remember like and I felt this very much at Yale. This was a lot of my inspiration is yes, they get paid well. They also dedicate like a decade of their life to not
Mhm.
getting paid well at all. And like, I mean, you're in med school, all your friends from like Yale who are like in finance, like making a ton of money, they're like moving around, they're doing their career goals, they're like planning for the future, and you're just like still wearing a backpack, and you're like hoping that one day this will all like come together. So I just think it's like a sacrifice that sometimes gets overlooked. And so what I would say is critical too, if we want to see this change, is we got to have someone saying we can't if we want people keeping doctors, you can't cut reimbursement rates when everyone else's salary is going up. And then I
Mhm.
think you'll see doctors say like, yeah, let's let more people in, but like not if that's going to further plummet the salary that, I was kind of was the thing that was supposed to make it worth it for me to go to school for like 15 years.
Yeah.
So, yeah.
Yeah. Okay, Jonathan, I know that you have to head out soon. Do you want
Yes.
to give a little bit of space? Are there any questions or topics that you want to get out?
No, I mean, listen, I think for I appreciate that, and for those listening in, I have to run to a Valentine's Day event that I double booked here. But no, I think listen, it's number one, Yale Angels and Accelerate Yale are here to support the broader Yale entrepreneurial ecosystem. So, if you're not aware of us, reach out to us here. I'm at Jonathan at YaleAngelsIndex.com. And there's a great group of folks behind both Accelerate Yale and Yale Angels who are really just looking to, again, support the community and the ecosystem at large. And then otherwise, I love the company that Natalia and her co-founder are building. I think this is a great conversation. And, one sort of parting comment that I would make is I think, again, with all of the hype that we're seeing in AI broadly, this is a extremely practical and important application of a technology that in all likelihood is going to change dramatically how we live and work. albeit perhaps it'll take a little bit of time. And Simbie's doing something that I think we all felt was really intriguing. So just appreciate you joining the conversation, Natalia, and sharing it with everybody. And yeah, just Ellen, thank you for putting it together. And Natalia, I'll let you guys continue on here.
Thank you so
Yeah.
much, Jonathan. And I just want to put in a plug that you and the Yale kind of angels and Yale Startup Index community have been absolutely instrumental for Simbie. You were one of our earliest investors. It's played such an important role, and I'm so excited to invest in like the Yale entrepreneurial community. And I think you're laying the pavement there. So thank you so much. And
Appreciate it.
any Yaleys interested in in this road, definitely reach out to me. Definitely reach out to Jonathan. He's an invaluable resource.
I appreciate it. Thank you. See y'all.
Thank you.
Awesome. Thanks, Jonathan. All right, we're going to continue on. So don't sign
Yes.
off, everybody. So actually, we did have a question come in around YC, and I think a lot of people are interested in kind of what does that experience look like? It's kind of the high status accelerator or community that people are interested in. So I do want to actually go back to kind of the founding story of Symbie and your experience there. So, one of the questions that we got was because all of the folks are younger and that average age of a Y Combinator company is actually dropping. I think like 10 years ago it was like 29 years old and now it's down to 23. What do you think made your application stick out? And I'm actually curious when you applied, like what was the company or what was the kind of progress that you had made? What was the company that you applied with versus like what did you leave YC with? So kind of what was the
Yeah.
transformation that happened during that time?
Totally. So we've transformed quite a lot since then, and one thing that I'll tell people, and I'm curious your thoughts on this too, Ellen, but I think pivoting is very normal and sh is a sign that you're thinking and responding to the market. So I think it's something that's to be encouraged. Um, and so for us, when we applied to Y Combinator, actually Rachel and I applied the first time and didn't get in, and this was with a different concept. Actually, it was not in healthcare. The other part of me and something that I'm very passionate about is, I spent a lot of my time at Yale studying gender and racial inequalities, gender and racial disparities, and actually my focus in medicine was, understanding the long-term health effects on inflammation of the chronic stress experienced by minority communities, by minority identities from discrimination. So, when I was at Yale, it was I became very interested in kind of that set of things. And so for us, when we went into it, actually the earliest idea was, okay, a childcare startup. Like, how can we make childcare more affordable? How can we make women's lives more viable in today. And so we applied with that. We did not get in, but what happened is we actually connected really well with one of the group partners who reached out to us after our interview, me and Rachel. And he was like, look, you guys are amazing. I don't think this idea is it, but I think you guys are amazing. And also, like kind of get it together and come back to us. And so we came back to them and then we got in the second time with, at that point, what we applied with, we were like, okay, my learning from this is it's actually very important to build what you know well. And that's why I kind of give that advice to people. Founder market fit is a real thing. So not to say you cannot build in something that's not your background, but uh, it's just not a bad idea to look to insights you've already developed over years. So then we applied to back to Y Combinator with what was my passion area at the time in med school and in the hospital, which still remains a future goal, is group medical visits. Group visits are a model of medicine that allows one physician to see many patients at once who have the same condition. So it's not only kind of like revenue perspective helpful for docs to see more people at once, but it also allows patients with similar, especially chronic diseases, particularly that have major psychosocial or psychological morbidity, for example, chronic pain, or, I was focused on kind of vitiligo and alopecia areata, um, for them to connect with each other. So we were actually building a group visits platform that allowed patients to meet one another who have a similar condition and see physicians together as a revenue model for docs. It was called Peerwise Medical at that point.
Mhm.
And so, yeah, we went through Y Combinator, we went through a number of pivots. We kind of realized that this group model of care, I think, will be part of our product, but it itself can't really be the core business model. The need is not strong enough. The pain point was not strong enough. So that's how we really pivoted. And today, as you know, we are an AI agents platform that kind of automates those between visit workflows, but actually we draw from our past, which is that we enable physicians to schedule patients for their follow-up visits into group visits. So, our cancer patients with chronic pain, our patients with chronic disease like endometriosis, fibroids are really able to meet together in a group. So what I'll say is your pivots often will always influence what you end up being in the future. But we certainly changed a lot in YC.
Yeah. Yeah. It is always so interesting to hear about kind of the different ideas that get explored. And I think for everybody who's interested in applying or, thinking about starting a business, one, I think from what you said, it's even if your first idea doesn't get accepted,
Yeah.
it's always worth trying again. One thing that I remember hearing when I was starting a business and that really stuck with me is that, especially with early stage businesses, is that people are investing in the founders, right? Early stage businesses, they know that you're going to pivot, they know that you're going to learn from the market. And actually, if you didn't, that would actually be a warning sign, right? That
Yeah,
you're not taking in new information, and that if the market changes, which these days with new technology, if you're not able to pivot, take in new information and incorporate that and learn from it, that's really kind of a sign that, you won't be able to keep up when things kind of fundamentally shift. The other
definitely.
thing that someone has said that makes a lot of sense to me is investors invest in lines and not points. So every conversation that you're having with an investor is a data point for them. And so
Mm,
even if with the first conversation, they're just getting to know you, they have no idea of your history or track record. Um, but as you keep in touch with them and as you kind of give people updates, they're starting to build a better picture of you. So they can see, okay, since the last time I talked to them, here's how they've grown, here's how their progress here's how far they've come. And so as you start to build up those relationships, it's never, okay, they didn't take us the first time. It means that we have to write them off. It's really, they haven't taken you yet.
absolutely. And
Yeah.
I would totally add to what you said, which is that like founding a company is not easy. It is not easy. It is a hustle. You have to hustle kind of every day. You have to like kind of you're putting a lot of yourself into something which obviously you care a lot about, and that's what makes us do this. You can't be if you're not motivated by like a greater goal, a greater vision of the world you're looking to build, like we are, like all founders are, you just can't endure this basically. It's very tough. And so I think another thing that folks are looking for is like signs of resilience and scrappiness, right? So someone asked, maybe your Y Combinator application or any other opportunity where you're looking for funding or kind of resource, what I'd say is like, actually, not only is it worth trying again, it's critical. If you want to be a founder, expect rejection over and over. I mean, literally one of the most important things is to be able to get up and keep going because no one, if you're not your company's biggest cheerleader, no one else is going to be for you. And also, if you have a vision of the world, the way the world needs to work, throughout the history of time, no one is just going to hand you a new way of being things or say, okay, sounds good, let's go for it, right? There's inertia in history. So if you're trying to change the way things work, you're fighting already. You're already upstream. So if you want to indicate that you're ready for this, and if you are ready for this, first check if you're ready for this. It is not a
Not
easy
for the faint of heart.
task. Yes. But if you are obsessed with something, like, I think for me, I knew early where I was like, I just like all I want to do is make a future where doctors and patients are respected in the healthcare system. All I want to do is to see my physician friends not be like spending 20 years training and then going home and like not getting to see their kids and then burning out and trying to find an escape path out of medicine 2 years in. Like that's what I'm seeing. Like this is not sustainable, you know? And then all I want is to have like patients who should live and do well live and do well, and that's not what we're seeing. So I think when you find yourself like obsessing over something and that's all you want to do and you find a path to go there, like that sounds like it's for you. And in that case, you want to show people your resilience, and it's critical for a founder. And then the other thing I'd say critical to show people is there's two layers I think that are really important for some of the founders I look up to most are one, vision. So like what's the world you're building? What does the world look like that's different that you're building? Like where are we headed here? But two, operational excellence. And those are usually two completely different things. And
Oh
I'll
yeah.
say like Rachel and I are like two halves of one brain in that way. Like every area that I think she that I have areas for improvement in, she is excellent in, and vice versa. So I think it is actually so critical to find who you're going to start things with, whether you're a solo founder or you're someone's co-founder. Like your co-founder will be essentially your spouse, like
Yeah.
your other
You
in
see them
every
more than your
way.
spouse.
More than your spouse, yeah.
Yeah.
And it's a relationship that requires so much trust. So I would say finding that person and then finding ideally someone who complements the areas where you have opportunity to be even more excellent is ideal.
hmm Yeah, it is. It's so important to find someone who complements you, and
Yes.
that kind of like vision and execution piece of it are so that's
So
so
critical.
important because it is I'm someone who's much more on kind of the practical execution side, but to be a founder, you have to be a little bit delusional. Like
Yeah, you totally do.
you have to have some of that delusion to say, I know it hasn't been done before. I know a lot of people have tried this and it hasn't worked. I know this is something that I have to convince people of. I'm not putting it's people aren't just going to find it and be like, "Oh, this is awesome."
Yeah,
But you have to be able to fight through that, and that
absolutely.
is a necessary quality of a founder. And being able to temper that with someone who's alongside you, who's kind of building that piece of it. I think
Absolutely.
one thing that I realize is like, yes, you want someone complimentary of your skills in your founding team, but you also need to have people in your network or that people that you can vent to that are
Yeah.
similar to you, right?
Yeah,
Where it's like people who can share that experience. And
absolutely.
and I think that's a big part of the network and having people in your network who understand your problems, but aren't necessarily in them with you that you can vent to because founding can be also a really lonely experience.
Definitely. It definitely can be. And I think to your point on network, like, again, to folks kind of thinking about starting a startup, especially in the Yale community, like the Yale community network is extremely strong. And I think something that can be leveraged is that, like reach out to like your Yale friends, like a number of them that you won't even expect will have found their way into the industry you're thinking of building in, will have found their way into venture, and you would be surprised how many of them do. And so I think that's been critical for us. Obviously, my co-founder is my Yale best friend, but also tons of the people that have helped us along the way, like a bunch of our friends who are in venture capital gave us kind of early guidance on like how do you make a pitch deck? How do you make a story that makes sense to folks who are maybe not maybe more lay experience in your field. So I think that piece is critical. And then, very practically speaking, like for example, for Y Combinator, I would definitely reach out to others in the Yale community to recommend your application. And even if you're raising from other entities, like when it comes to raising money, yes, being able to speak to your network and leverage who you know already is really important, right? That's where you begin kind of spreading the word about what it is you're building. So.
Mhm. Awesome. Actually, since we're talking about network, I would love to hear kind of some of the other ways. I know we've had the conversation about why Startup Index, and we've had kind of the conversation about people that you know. Are there any specific anecdotes of like, here's someone that you wouldn't have imagined that you would be kind of having professional conversations with when you think back to like college days?
I mean, it's a great question. I mean, probably so many folks. Like, I think obviously Rachel and my relationship itself, right, started at like, bulldog days, and you're like in college
Mhm.
and you're like freshman, you're running around just like trying to figure out who you are and like, like having a ball at Yale, work hard, play hard energy. And then yeah, I mean it's really interesting to go from that to being like, oh, you're in a professional business relationship. I would say like early friends again who've definitely helped us a lot. Like I think you all might have had her on actually. Becca Liu is one of our good friends
Mhm.
from Yale. She's in VC, and actually one of my earliest conversations where I was thinking, hey, I might want to like build something, out of medicine, was with Becca, and she, we stayed close since Yale. And I was like, what is it? What do you look for as an investor? What do I need to think about here? She gave me a lot of early insights. And from someone who my day to day at that point was like scrubbing in for like into the OR for operations and kind of doing rounds on the clinic floor. So that wasn't the world I was spending time in. So yeah, she's definitely someone who played a critical role. I think a lot of our friends in venture for sure. Like I said, Tapley and Sam Oblitz, who just kind of like got successfully acquired recently with their startup Claim. We've reached out to them for help. And so yeah, I think Yaley's along the way. Um, and Javon Lawrence, he's another one. He actually was our year 2014 at Yale. He's also in kind of the startup world, was a founder, now very involved in VCs. So honestly, it's like a lot of the Yale community. And I would say what's really important here is Yale creates, and I certainly felt this feeling, and the thing that I think unites Yaleys is like a obsessive curiosity about something that is beyond needing to get motivation from just like a direct incentive, like where it's like, oh, you're only interested in it because you get paid for it for your job, or you're only like, I find Yaleys are people who in general tend to be like so motivated towards something because they're just like deeply obsessed with that idea or problem or issue or whatever it is. And I think what Yale does is it takes a bunch of those people, puts them in one place who approach the problem from completely distinct perspectives. Like I'm coming in there from like the Midwest. It's my first time on the East Coast, coming with this like doctor perspective. And then my roommates at that time, like a lot of their families are from like finance on the East Coast, a world I had like no idea about. I went first time someone at Yale told me finance, I thought they meant like they work as a bank teller. Like I had no idea what that meant. And so I think just the way it like opens your mind to like, hey, there's like many ways to solve a problem. And if we all put our heads together, we can probably find something that people just staying in their own industry in their own lane wouldn't have. So yeah,
Mhm.
I would say like lean into like the diversity of your Yale network and what they've ended up doing in life.
Awesome. I think we've got about a little less than 15 minutes. So I want to make sure we've got a few questions in the chat. And I did want to actually touch a little bit on the AI aspect of it, but I'll pull in a question from our Q&A. So we had someone ask about Epic and Cerner. They're kind of the big elephants in the room when it comes to EHRs. I know you mentioned that Symbie is integrated with the EHR. Can you talk a little bit about how you've managed, like one, do you integrate with them? And then two, how do you manage that? Because I know that doing an EHR integration and getting access to the data that's in their systems is very difficult.
It is difficult, yes. I will say, so how? I mean, I think the most important thing when it comes to EHR integration, it definitely varies EHR to EHR. So like Epic, yeah, everyone knows they're sort of the behemoth in the space. Um, I think sometimes people say like, oh, it's hard to integrate with Epic, but then we all just kind of keep echoing that, and then we don't necessarily know what we mean by that or why. And I was kind of curious going into this about that. Like at University of Chicago hospitals, I used Epic, and I was very familiar with it. The reason they're difficult is actually not because of like some technical complexity. The reason they're difficult is because they have the leverage to stopgap
Yeah.
the entry of developers into their system, which they know is very valuable to like integrate as a third party. And in general, it's a company that leans towards instead of letting in outsiders to building it internally themselves. And I have to say, they've been extremely successful from that perspective. A downside is obviously it can be a little thwarting to innovation to like keep it closed. So it's a balance. But I would say the important thing with like Epics and Cerners is actually like network because like the way we've gotten integrations has been by having our customers reach out to their to their health systems where they have admitting privileges or where they round and see inpatients and say, "Hey, like I use this in my private practice. I need this here. Do it
Hmm.
now," you know? And the thing is, any company, if you're trying to like engage even outside of healthcare with any big company that has like major leverage, your strongest leverage point is going to be mutual customers. So that's one thing I would say, like, certainly lean into. Obviously, if you know, I mean, what everyone comes to see is it really does matter who you know, for better or worse. If you know someone high up at Epic, if you know someone who's in charge of technology at a health system that uses Epic, like these are people to reach out to because ultimately the thing that will accelerate your integration is like leverage, and that comes from usually mutual customers.
Yeah.
In terms of other EHR integrations, like, you know, the other ones we actually started in private practice. So like, you know, eClinicalWorks, Athena,
Hmm.
kind of things like that. For us with that, it was more straightforward. Like you basically go to your customer and, you know, they want the thing, they sign the contract. And so then typically it's on them to kind of connect you to folks at their EHR system to say, please give them API access, etc.
Yeah.
Interestingly enough, though, for us, many of our functions that we do, results review, reviewing orders, test results, you know, even document handling, don't have APIs endpoints even for them. So that's the complexity for us. It's actually less about like, can we get API access? It's more like,
Hmm.
how do we build for something that EHRs don't even expose as an API endpoint?
Yeah, that is API access is, but it's never been better, but it's still not great.
Yes, exactly. There's a lot of room for improvement. I will
Yeah.
say like
And
some
there's very little incentive for them to develop externally facing and externally consumed APIs.
You know, that's what it is. And I think that is unfortunately, I think I saw someone's comment in the chat. Like, this keeps me up at night around like, where is the healthcare system headed? And sorry, the room got like so dark. So I'm just like sitting in the dark here now. But one thing that keeps me up at night is like, how do we conceptualize the future of our healthcare system? When we think about a mostly privatized system, is where we have a lot of questionable incentives like this, which is like an incentive to stay closed off, an incentive to not collaborate if you want to control market share. And yeah, it really does make me wonder like how much we can really be at the cutting edge if we're not implementing things that are more of a you know, sharing in the commons, for example, universal healthcare access that would allow the, you know, misaligned incentives of insurance and payers with providers and technologists to sort of be mitigated. But to this end, I think like similarly with technology, right? These EHRs, yes, they're motivated to have all for themselves and to not be a sharing economy. It's not like when we share, we all rise together, which I do think there's a role. And from a policy perspective, I'm very interested in pushing forward as a company more as well.
Yes, a lot of some of the business, like the ways that the technology has developed and the care, like the business models have developed in healthcare can be tied directly back to policy, right? You know, it's like
Exactly.
one line in one, you know, in one bill somewhere causes so many downstream impacts for like how you build technology. There's a lot going on with like TEFCA and data sharing and people's access to their own health records. um, that's kind of, you know, all currently in flux right now. And so, you know, I think one thing to keep an eye on if you are interested in healthcare is how are the policies being written and how is that going to lead to downstream impacts in terms of how easy it is for people like us to be building technology that sits on top of those layers, and to make that data more accessible while still retaining kind of privacy and security for patients.
Absolutely. Absolutely. And I would say like, you know, I think like me going into this space, my background is really where this all started for me in healthcare, like I mentioned, was in like disparities and inequality and, you know, my actually like healthcare advocacy for non-English speaking patients, immigrant patients, you know, sexual and gender minorities, women in the healthcare system was like my entire kind of backdrop that brought me to the system and advocating for kind of folks without a voice. And I think sometimes it feels like you have to act, when you're entering a space like tech, which for me was new, that you have to act like everyone acts in the space and you should almost mold to be how they are. Like we're already female founders, which makes us like very rare in the space, as I know you know, Ellen. Like
Mhm.
in YC, less than 9% of our batch was women.
Yeah.
So yeah, we were one of few. And so I think sometimes there can be this pressure to say, I need to kind of just like become like everyone else. And then you're like, oh, okay, maybe building technology, building startups is incompatible with advocating for things like universal healthcare, for things like equity, for things like it's actually a good business argument to make tools that enable access for the most marginalized patients. But I think the reality is like the future of what I'd say like capitalism and like in the US and healthcare technology will require leaders who think and speak differently. And so what I would encourage people to say is like you won't immediately always get like a positive reaction from people, but I would come in strong with like what sets you apart and what you believe or know that is different from what people believe or know. I guess leaning into that throughout my career has been what I always look back on, and I'm like, man, I'm grateful I was courageous in that moment and said something that maybe wasn't the most popular opinion in the room, but like I do think that's the vision we need to move towards.
Awesome. Well, we're in our last 5 minutes. One question that I did have, and if we don't have enough time to get into this, we can always save it for another conversation. But one question I had was like, what are some of the interesting things about starting a AI business in this day and age, right? I feel like it's being thrown around as a buzzword everywhere. So how do you stand out and how do you kind of stay up to date as a business building kind of in the AI space?
Yeah, it's a great question. I mean, I would say there's so much hype, obviously, about AI. Um, but I also think a lot of it is appropriate. Honestly, a lot of what we're able to do today, like we're able to automatically generate like a patient conversation when the results come in. That, like, for example, one of the things we do for one of our practices, their primary care results come in for their hemoglobin A1C, very common blood test that we use to track, people's essentially risk for developing diabetes. And the number of results that just sit in doctors' inboxes for days and days, because honestly, the more acute patients like that, you literally need to call them tomorrow because their potassium is high and they could be at risk for something cardiac, like you're going to get to those first. Then all the people that, we speak about preventive care and moving more in that direction, all the people that are they have a little bit of a concerning hemoglobin A1C, but it's not going to kill them in the next like few weeks. That gets pushed to the bottom, and that the number of patients who actually get an appropriate outreach to discuss what this blood test means, what you can preventatively do to protect yourself moving forward is so sparse because there's just not enough people or resources in the system. By the time your nurses, your medical assistants, your doctors do like the bare minimum to like keep up with like making sure everyone is just well enough, prevention it just completely falls off. Today, we can automatically trigger outbound phone calls to our patients that discuss with them fully in depth what hemoglobin A1C means. Why are we tracking it? And I'll tell you, we have patients who on that phone call with our AI agent are like, this is the first time I have literally ever had anyone explain to me what the heck is pre-diabetes and like how is that different from diabetes and like what is the line, and I just never had a chance to ask that in my visits. So the things it's unlocking are honestly unbelievable. What I will say is to the hype. Yes, there is a lot of hype. I think the important thing is to, again, always be just let your North Star be the problem you're solving. If your North Star is the problem you're solving, then the solution you use to get there will continue to evolve. Tomorrow, we're going to have better computer vision tools. We're going to have better computer use tools, which we're keeping our eye on. You should continue to evolve the tool you use of the day, right? To follow it. But what should
Mhm.
stay the same is like, what am I solving for who? Then I think how you use AI or not is a little less important than like what it enables you to do. If it
Yeah.
enables you to do something better, freaking use it. Why not?
Awesome. So really focus on the results, not so much AI is a convenient shorthand for a lot of different things, but
Yeah, it's a
really like
tool.
how are you using it, right? Like
Yeah, and
how are
remember
you?
it's it's a
Yeah.
tool. It's a means to an end. It's not like
Mhm.
AI is the end in itself,
Yeah.
unless you're building a model, I guess, in which case it is. But
That's a
use
very
it as a
small.
means to an end.
Yeah.
Yeah,
Yeah.
yeah, yeah. Yeah.
Um, awesome. Well, we are at time or close to time. And we did have a question in the chat, but also, how do folks keep track of what you're doing or get in touch with you?
Um, yeah, so please feel free to email me. Can I put it in the chat? Natalia at Simbie.ai. I'll just put this Simbie.ai in the chat. Hopefully everyone can see that. You can add me on LinkedIn. You can, follow me on online. I think LinkedIn is probably the best way to connect. Natalia Neha Khosla on LinkedIn. I'll write that down.
Um,
Um, and yeah, for folks especially interested in founding, I'm very happy to talk about it. As a first-time founder who came from outside of tech, female founder, there were a lot of things that were very much, I'm not like the typical person in this space, and I think for anyone, it can be an overwhelming and intimidating journey, but you're definitely in the right place if you have an idea, a problem you're looking to solve, like that's where it all starts.
yeah. Awesome. Well, thank you so much for your time. This has been awesome. I know I'm looking forward to connecting further on some things.
Yes.
Um, everybody, feel free to reach out to us. We are team at accelerate.yale.org. Thanks, Henry, for posting Natalia's email in the webinar chat. We will be posting a recording of this on the Accelerate Yale YouTube channel in the next sometime next week. We'll have it on LinkedIn and we'll let y'all know through our email list as well. This has been fantastic. Thank you so much for your time here. Hopefully, everybody on the webinar got to take some good takeaways here about healthcare, about your story, and about some of the opportunities there. Yeah. Any, I don't know. I don't necessarily have any last thoughts, but uh, I really look forward to seeing more of Simbie in the news.
Thank you so much, Ellen. And yeah, I'm really excited for us to chat more after this. And yeah, I would say to everyone, like don't doubt yourself. It's like you have to kind of know that what you have to bring to the table is like worth it, is unique. It sounds so cliche, but like one of my main takeaways from this journey is like trust your intuition. You're usually when you know a space, you're usually onto something. But that just because you're onto something doesn't mean everyone's going to immediately like be like, yes, take my money, like let's do it, I'll be your customer. Resilience is key. In YC, they tell us be a cockroach, just don't die, just
Yeah.
stay alive. That's like keep that the goal. So please reach out. Happy to chat about it all, and
Yeah.
really appreciate the Yale community.
Actually, that does remind me. One of a nugget of wisdom from another Yale founder is in startup life, it really is all about luck, but you have to stay alive long enough to get lucky. Um,
Exactly.
and that's
Part of it
really,
is that it's
yeah,
like
it's
entry. I mean, I describe it as like entropy, right? Like you
Mhm.
have to like to experience like the longer you're around as a little atom or a little molecule, the more likely you are to just like bump into other molecules and like have interactions happen. And so if you can just continue to exist in the ecosystem, things happen. But the statistical likelihood of that happening increases the longer you just continue to be there. So just keep your head up. There are hard times in the founding journey. Me and Rachel have been through hard times. But you just gotta like stay resilient.
awesome. Well, I think that's a great message to leave everybody with. Thank you, everybody, again, for all of our attendings for joining. Thank you to YAA for facilitating this webinar. And I'm going to shout out to Jonathan. He's not here. Reach out. I think I put his email in the answers in the chat. Um, yeah, we are here to support your journey. And absolutely, we will hopefully see everybody again on another webinar.
Sounds great. Thanks so much,
All
Ellen. Thanks
right.
for organizing.
Thanks, everybody.